Hi, my name is Catalina Davalos, and today we're going to be doing some mobilities at the hip. First, I'm going to do 2 active range of motions for abduction and adduction at the hip. Then I'm going to do 2 manual muscle tests of the glut minimus and the gross hip adductors. And then I'm going to do a muscle length test for the TFL and the IT band. For my first active range of motion, I'm going to be doing hip abduction. For hip abduction, I'm going to have the patient in a supine position with a non-test leg on a stool to stabilize the contralateral hip, and I'm going to manually stabilize the ipsilateral hip. Once I do that, my goniometer, the axis is going to be at the ASIS, and my stationary arm is going to be pointing towards the other ASIS, and my movable arm is going to be midline of the femur pointing towards the patella. So once I do this, I'm going to ask you to slide your leg towards me as far as you can. And once I feel the pelvis moving, I can ask her to stop. And I get 35, which is within the normal range of 0 to 45 degrees. Now we're going to be doing adduction active range of motion, and for this test, the patient's also going to be supine. The non-test leg is also going to be on a stool to stabilize the contralateral pelvis, and I'm going to manually stabilize the ipsilateral pelvis again. Axis is going to be the same. It's going to be at the ASIS, and my stationary arm is going to be pointing towards the other ASIS. Movable arm is going to be pointing towards the patella, midline of the femur. And then I'm going to ask her to slide her leg opposite, so towards midline. And I'm going to measure, and I get 18 degrees. And normal for adduction is 30. Now we're going to be doing manual muscle tests. My first manual muscle test is going to be glut minimus. For glut minimus, I'm going to have the patient in a sideline position close to the edge of the table. Their hand in front of their trunk for support, and I'm going to be stabilizing at the hip. I'm going to bring their leg into abduction. Since they can hold it against gravity, I would already give them a grade of 3. I'm going to apply gradual resistance for 3 to 5 seconds in the distal tibia into the direction of adduction and slight extension. 1, 2, 3, 4, 5. And since they were able to hold it against maximal resistance, I would give them a grade of 5 out of 5. Manual muscle test, I'm going to be testing the gross hip adductors. For that, I'm going to have the patient in a sideline position with their hand in front of their trunk for support. What I'm going to do is I'm going to bring their non-test leg into abduction. I'm going to support it and stabilize the hip or the pelvis with my elbow. What I'm going to do is I'm going to bring the test leg into adduction, and since they can hold it against gravity, I would already give them a grade of 3. I'm going to apply gradual resistance for 3 to 5 seconds in the distal femur. 1, 2, 3, 4, 5 in the direction of abduction, and since they can hold it against maximal resistance, I would give them a grade of 5 out of 5. For muscle length test, I'm going to be doing the Ober's test, which is testing the length of the TFL and the IT band. So for this, I'm going to have the patient in a sideline position, and they're going to be holding their non-test leg into a 90-degree angle. You would hold it with both your hands. And I'm going to be behind the patient, making sure they're stable in a sideline position. So what I'm going to be doing is I'm going to be flexing their knee and bringing their hip into extension and adduction. For the modified Ober test, the knee would be extended because they have tightness in the rectus femoris. So what I'm going to be doing is I'm going to be gradually lowering their leg and seeing where it falls. If the leg comes forward and it does not touch the table, then that would mean that they have tightness in the TFL and the IT band. And since it's below the horizontal line, I would say that she has a minimal tightness.